Illinois. And Jared is with us tonight. He can wave if you want to see who he is. And then at 7 o'clock, our partners at the Kepler Institute will join Midtown for a presentation on the revitalization of the Concord building at 3802 Illinois. So literally the east, the west, and the south ends of Target and Park have projects that will all be under construction at the same time. And so tonight we're going to just kind of walk through those. And if you have questions, if you wouldn't mind just flowing those through the chat, and we will monitor that. And at the end of each presentation, try to address the questions about each project. Does that sound reasonable to everybody? If so, Tom, if you can advance that, we'll start talking about Parkside at Targeted. So again, I'm Michael McKillop with Midtown Indy. I'm joined by Drew Rosenberger. Drew is with Flaherty and Collins and Vision Communities. We are partners on the redevelopment of the former United Way headquarters. It's about a 75,000 square foot building built in the late 50s or early 60s. It's sort of often likened to a concrete bunker. It's been vacant since the United Way vacated it in late 2015 or early 2016, while our partnership team worked to identify the funding to redevelop the property at the request of United Way of Central Indiana into a multifamily housing development. Our focus for that development is senior housing, and we were thrilled to receive the support of all 5 surrounding neighborhood organizations in 2017 when we rezoned the property from a mix of office, C1 to MU1, which is mixed use office and residential in 2017. And so tonight's meeting is to generally provide a timeline update since this project has been underway for over 7 years. And some folks have probably remember it was going to happen a long time ago and it's taken a long time for it to happen. It's now finally happening and a few things have changed along the way. Some of those changes have required that we go back to the Metropolitan Development Commission to amend the site plan. And we'll talk about that a little bit. The other piece of this is that to make this development viable, we have been working closely with the city of Indianapolis to negotiate something called a pilot agreement. And a pilot stands for payment in lieu of taxes. It's essentially an opportunity when a community focused project like senior housing is being built, to reduce the cost to those seniors and occupying their unit, and to the developer, we work proactively with the city to negotiate a lower than standard tax rate for that housing. And so that is something that the city is conditionally approved based on community feedback. And then effectively, Drew will give us an update on the construction timeline, because many of you, if you live in the neighborhood, probably saw that a few weeks ago a fence went up and it looks like people are actively working over there. And so with that, we will advance to the next page. What is at issue? So what you're seeing here is essentially the renderings of the north and south elevations of the building. You'll see lots of glass and lots of color. The project was very keen on focusing on the transparency of the street-facing facade. We extended that past the actual Meridian Street face a little bit back so that as you drive by the building, you're really maintaining that transparency. And Tom, if you can continue that slide. The units are all configured for a total of 60 units of 55 and older housing. I believe 8 of the units in the development are reserved for individuals with mental or physical disabilities under a voucher program with the state of Indiana. So you will either need to be 55 or older or meet the conditions of that developmentally or physically disabled housing requirement, but essentially there are 60 units of housing, and each of the floor plans, while there's a slight variation, all look pretty much like the one you see here, largely 1 and 2 bedroom units throughout the development. What is at issue with the zoning is here you'll see the site plan from 2017. And in 2017, we aspired big. We thought, man, we could maybe add a story to this building. We thought, hey, we could probably put some apartments on the north parking lot. And I think the realities of not only the challenges of redeveloping a building with structural challenges and environmental issues, but time has led us to believe that the most viable redevelopment of this property is just of the building itself. And so this site plan sort of shows that there might be another building on the north parking lot. It also shows a parking garage, which is existent on the property, but unfortunately, after significant and expensive engineering assessments of the parking garage, we've determined that the garage needs about $3 million in repairs, which are just not feasible under the redevelopment plan. And so the plan is currently to remove the parking garage and replace it with surface parking, and to not move forward with this north parking lot independent housing that was originally envisioned back in 2017. And so, Tom, if you'll advance to the next slide, what you'll see is there's no major physical change to the site itself. The parking lot doesn't take up any bigger of a footprint than the parking garage did. There's just more surface parking and less housing on the north end. The other minor change is that we're not adding a sixth story to the building, but effectively the footprint of the project remains pretty much unchanged from 2017. But what has to happen, and there's a zoning case on August the 26th at 1 p.m. Before the hearing examiner to discuss that original 2017 site plan and this site plan. And since we had so much community input back in 2017, we wanted to offer, despite the pandemic, an opportunity for folks to understand the changes that have been made and to ask any questions that they may have. And we will certainly do that as we end this in this presentation. Tom, if you'll skip on. The next matter here is really that the MDC is being asked to modify the commitments to the zoning that were made in 2017. Those essentially were that the site plan would remain the same, and the changes to the site plan are we're not building the north surface parking lot and we're taking down the parking garage. So we have to amend that site plan and elevation with the city. And effectively, Tom, if you move on, essentially, that's the zoning case. The zoning case is we're not building on the parking lot and we're not building a sixth story. And so we need to submit these new site plans as shared with you tonight to the city and ask them to support it on August the 26th. The second matter for consideration is before the Midtown Economic Council, and I see a few other MEC members joining us now. That relates to the payment in lieu of taxes. Because this project is in a tax increment finance district, there is a volunteer body of individuals that have formed back in 2014 called the Midtown Economic Council. They're residents, just like many of you who might be watching this, who have been nominated by their organization to represent the interests of the tax increment finance district. So essentially, anytime TIF is offered, tax increment financing or tax abatement or some effect to a property inside of that TIF district, we ask the MEC to review the project and to make a recommendation before it goes before the city council or the MDC for consideration. And so tonight, what we are presenting is that we have pre-negotiated a pilot, I explained that earlier, a payment in lieu of taxes agreement with the city, subject to approval of the community and of the ultimately of the city council. This payment in lieu of taxes would essentially reduce the tax base, the tax charges to the residential components of the development. The development has 60 units of residential and it has about 8,000 square foot of commercial space. This pilot agreement really only applies to the 60 units of senior housing. It would reduce the tax bill for those 60 units of seniors such that we don't have to pass that cost on to those seniors and to sort of make the development more viable. The pre-negotiated rate is the taxes would normally on this new development be about $50,000 a year for those 60 units. And we've negotiated with the city that we would pay taxes on $35,000 if they could write off that $15,000. That $15,000 is not flat. Each year, the taxes under this agreement would go up 2%. So it wouldn't be static. It would continue to escalate with the average rate of appreciation in the community. But effectively what this does is it saves about $144,000 off of our tax bill over the course of 15 years, which helps us keep those rents low for the seniors and intellectually and developmentally disabled individuals who choose to live here. It does not include the commercial space. The commercial taxes will remain at market rate, which that 8,000 square feet would be charged about $24,000 a year in taxes. And since I feel like I've been talking consecutively here for about 15 or 20 minutes, I'm happy to sort of pause and let Drew Rosenberger add anything he would like to add to the project. Drew works again for Flaherty and Collins and Vision Communities and has been the project lead alongside of us here at Midtown and helping to bring this project forward. So Drew?
Sure. Yeah. Hi, everyone. Thanks for the time and thanks for having us. I think one thing that I'd like to add on the note of the site plan and the MDC approval that we have to get is that the site plan that we have presented does fit within all of the MU1 guidelines. So we're not requesting any variances from those guidelines. We really just have to go back and revise the commitments that were made when this site plan was originally approved back in 2017. So I just wanted to clarify that we're not asking for any variation from the zoning code. We're just, we are in compliance with the MU1, but we do have to just revise those commitments that were originally filed with the site plan approval. And Michael also mentioned the construction timeline. So we did, just earlier this month close on the project and start construction. So the first major thing that'll be happening will be tearing down the garage, and then we would then go into removing the skin of the building and continuing on from there. So the project would be scheduled for completion in October or November of 2022. And then we would start leasing up the project about 3 months before completion and lease up hopefully pretty quickly after completion. I'm trying to think if there's anything else that you missed, Michael, but I think
would you mind taking a moment and just sort of sharing with folks what the total investment and the scope of the project budget is? It's it's probably the largest financial investment in the community in about 35 years.
Yeah, and so this since 2017, construction costs have risen, and we discovered some challenges with the building that increased the costs. And so since that time, we've gone out, and Michael and I have been working on raising additional funds to bring to the project, including this pilot agreement that's here that allows us to raise more debt for the project. And the total price for this project has ended up coming in around $15 million. Which is a substantial increase from the initial project budget. It's more than a couple $1 million of increases over time. So, we're with those challenges. We're thrilled with the design we've been able to put together, and then also just to be able to finally get to closing. We're pretty proud of that. Anything else, Michael?
I think that covers it. I would like to take a moment to ask Nick and Elizabeth and any other MEC members if they have questions about the pilot agreement, and then open it up to general questions about the development or the timeline, et cetera, from anybody else participating in the call. Nick or Elizabeth, any questions?
No questions from me.
No, I was just I believe you said it, but so the commercial section of the project is still at regular property tax rate, correct?
That's correct. There's no abatement or offset of the commercial taxes on the project.
Okay, that was all I had.
Okay. Anybody else on the call have questions about the project, the design, any part of this particular presentation before we ask the MEC for a recommendation?
I think it might be helpful to suggest what kind of retail or commercial tenant you're looking for the ground floor.
Sure. So the focus has been based on community feedback. I think from the beginning, the community has sort of wanted to see more community services in retail spaces. And so retail is actually the wrong word. This was zoned MU1. So the focus is on office and residential. And our team focus has been on meeting one of the most unmet needs in the community, which is healthcare focus. We have a highly healthcare intensive tenant population in the building. And originally, Socoa was going to be part of the project. Unfortunately, the pandemic and some leadership changes changed their ability to move forward. So we are in early negotiations and are in search of health clinic focused or health services focused office tenants. It could be a doctor's office or a dentist office, or it could be a senior services care organization to occupy this 8,000 square feet on the first floor. And I think it's important to mention that the city is partnered with us and has offered something called new market tax credits, which offer us a unique financing solution to sort of help defray the cost of that organization on the front end to move in with an interest only, I think up to nearly $2 million of build out funds to sort of help them ease into the building and get operating before there's really any major cost to pay for their build out in the space. And it's a truly unique opportunity. That this area is not only a food desert, it is also a healthcare desert or health services desert. And so our team remains focused on finding the right tenant to occupy that space with a strong focus on the healthcare sector. Anything you would add to that, Drew?
The only thing I would add is with that new market tax credit funding, we're somewhat required to bring in a community-oriented user, and would be prohibited from bringing in any SIN type businesses or anything like that. Not that that's what we have envisioned anyway. But yeah, just to reiterate, we will be heavily prioritizing healthcare services and community benefit in that space.
I agree. Are there any other questions from anybody in the audience? No? Well, Tom, if you can scroll back to the rendering of the project, we will sort of circle back and see if there's any further questions from the MEC, and if not, we'll be happy to consider a favorable recommendation or otherwise to recommend the MEC endorse the pilot agreement.
I don't have any further questions. If there aren't any, I'm happy to make a motion that the MEC would move to recommend approval.
Appreciate that, Nick. Elizabeth, on behalf of Broad Ripple, would you maybe make a second?
Unmute is helpful. I second.
Well, Midtown actually abstains from voting on projects that it has a direct investment in, and so it would ultimately. I did receive Mapleton Fall Creek's endorsement prior to the hearing, and so if Meridian Kessler and Broad Ripple are supportive alongside of Mapleton Fall Creek's prior endorsement, then we would be able to move that forward with a motion and a second, and we can end that part of the program if there are no more other questions.
Yeah, thanks for all your hard work, everybody on this. What a great project it's going to be. I know it's been a long time coming, but good things come to those who wait, right?
Mm-hmm.
Yeah, we would have appreciated some of those things, somewhere between now and 7 years ago when we started this thing. But I think we all had more hair, and I think Drew had less children when we started this, but no children actually when this thing started.
Now I have two.
Too strong. So we are thrilled about this, and I think our goal in partnering to on this particular project was to stave off a 75,000 square foot vacant albatross around the community, and to sort of diligently work to ensure that it had a future purpose that met a community need. And I don't think we heard anything more strongly than we heard about the displacement of seniors from our communities. And here we'll have 60 units of very affordable housing, and we're proud to be part of it.